In this video, I'm going to demonstrate application of the use of the forearm and the knuckles on the wider back area. So it's a heavier pressure technique, and these heavier pressures are going to be great at helping to increase localized blood flow and helping to reduce muscular tension and associated pain and discomfort. Okay, so as with all of our massage techniques, when we're applying slightly heavier pressures, then we do want to warm up the area first. So we would have done our effleurage techniques around the whole of the wider back, including those upper traps and the neck, along with our petrissage techniques, including kneading, wringing and rolling on the back as well first. Okay, so we want to apply our massage medium, and today I'm using lotion, but you could use your oil or your wax as well. And I'm just going to apply that with a little bit of effleurage around the upper traps, coming up the back. Just being mindful of those spinous processes and making sure that we're not pressing down over those spinous processes. Okay, we want a nice lunge technique with our legs, and we want to be making sure that our upper body is sort of staying over those hands and the hands aren't escaping too far from the body, otherwise there'll be too much pressure through the arms and you're not applying your body weight appropriately. Okay, so if we fast forward that we've done our warming up techniques here, so our effleurage, our 1,000 hands and our long stroking and our petrissage techniques. Then from here, we're going to come into the use of the forearm in the lower back space here, in between the pelvis and the lower ribs. We're then going to use the forearm coming up the opposite side of the back as well, along that erector spinae area and into the upper traps. So we want to make sure that we are applying that pressure evenly through the forearm. Okay, often it's nice to apply a twist here as well. So you might be starting with that loose hand, coming down into that waist area and then twisting and lifting as we come back up again. So pressing down and then with a twist and a lift. So we're trying to stretch the tissue in both directions here, slightly moving that forearm closer to the iliac crest, and then also in some instances closer to those bottom ribs. So you're really getting into that whole space of the lower back and oblique area, and think about applying that pressure from that erector spinae. So as soon as that hand comes into that space, we've got the pressure coming down into the tissue now, and then we're coming up and over so that we're stretching all of that area. Once we've done that about 3 to 4 times on the opposite side, so you're leaning over your client to apply that pressure, then from here we're now going to move to the side of the back that's closest to you, and we've got the forearm in a long direction coming up the lower back. Then we're changing direction as we come into this thoracic area, so we're not pressing over those spinous processes, reinforcing with your hand onto your palm and then following this forearm into the upper traps. Now as you come back up again, you're creating that lift in the tissue, similar to what we did in that lower back area. Pressure is coming on through that forearm as we come down, and then changing that forearm direction, okay, in that lumbar area so we can cover more tissue. And again, lifting and coming back down. So if we wanted to do the other side of the body, I would then stand on the other side of Katie. So I would move around to treat the other side. So it's quite nice to reinforce on that hand with the pressure as we're sweeping up and down the back. Okay, then we can also use those knuckles as well. We can do a looser knuckle. So with our knuckles, there's a couple of different hand positions. We can either tuck our thumbs in, but we want a relatively loose hand, or you can have those thumbs pointing out to the side. To start off with, to apply that heavier pressure, we can knuckle up both sides of the erector spinae and then come into those upper traps, and then back down again. Or you can use that single-handed knuckling technique, coming up one side and then over to the other side of the back. You can also, depending on the size of your client, turn your hands so that the thumbs are pointing up towards the client's neck, okay, or turn the palms so they're in a more of a broad position. So the fingertips are pointing down towards the bottom. Okay, so you're just thinking about the tissue here and what you're trying to release. So you might be doing this long stroking motion with the knuckle, or you might be doing a shorter stroking motion with those knuckles as well, especially if you want to be more targeted around this lumbar area and that quadratus lumborum area. So if we had some tight trigger points around that QL area, we could reinforce with those knuckles. Okay, one side and then the other side. So long strokes with those knuckles coming up the back and into the upper traps, or shorter strokes as well as you're moving up, depending on how that tissue feels. The knuckles are also great coming into the upper traps. So from here, we can use those hands either side of the neck, pushing down, using your body weight, either with your legs in a lunge position or a squat position here, starting that pressure from the C-spine and pushing outwards towards that acromioclavicular joint, then sweeping back up again and then pushing out and just changing the positioning of your hands slightly so you're covering all of that upper trap area. Again, leaning into those hands with your body weight. So although we're using that heavier pressure of knuckling, you're also providing that additional pressure through the use or appropriate use of your body weight. Okay, we can also use our forearms here into the upper traps to provide that nice stretch. So in this instance, either again using your other hand to guide or taking your other hand behind the head as you're sliding that forearm from C-spine towards the AC joint. Okay, doing one side and then swapping your body positioning over to do the other side. Okay, so just to recap here, so I'm just going to flush that a little bit. Okay, so with our heavier pressures, we're always flushing in between application. So for our long forearm up the back, we can then do our soaring technique into the obliques or that lumbar region. Then we can come up, so side of the back closer to you, broad as you're in that lumbar area, then turning that arm position. So we're following the erector spinae group up the back, coming into the upper traps and back down the back. Okay. So we would do that on both sides of the back, just swapping sides. And then from here as well, we can use those knuckles into the oblique area. Loosish, I should say, knuckles, getting tongue-tied there. So coming up the back, also into those upper traps with the knuckles too. And we can do our long sweeps with the knuckles, or we can do these short sweeps with the knuckles as well. It's nice to come around that scapular area with the knuckles too. So always use your fingertips first to feel where the edge of the scapula is, and then you could follow that round with the knuckles. So just be mindful of those bony borders. And then finally, coming into the C-spine, upper traps with those knuckles, and then also using the forearm as well into those upper traps, which often feels really nice as most of our clients have got a lot of tension around the upper traps. Okay, so that was our demonstration of our heavier pressures using the forearms and the knuckles on that wider back area. And we would incorporate these heavier pressures with our other techniques, such as our effleurage and our petrissage techniques. And we can also combine them with our soft tissue release, active movement techniques, and also with our trigger pointing technique as well.